No president tried it until the supremely effective Franklin Delano Roosevelt in the 1930s, and he couldn't do it. His successor, President Harry Truman, tried and failed. Then no president tried it for another 20 years until Lyndon Johnson became the first to succeed where everyone else had failed. Then Richard Nixon tried and failed. Then another 20 years passed before another president tried. That was Bill Clinton, who tried and failed. And then George W. Bush tried and succeeded in a very limited way, followed by Barack Obama, who tried and succeeded big time, provoking Joe Biden to whisper at the bill signing that it was a big effing deal.
Ladies and gentlemen, the President of the United States of America, Barack Obama.
Donald Trump was the first and only president so far who tried to take away some of what had been won, but he failed. And then Joe Biden tried and succeeded. Of the 46 presidents, only 4 of them have been able to pass major health care legislation. Lyndon Johnson was the first big winner and remains the biggest winner, having passed through Congress and signed into law Medicare and Medicaid. George W. Bush passed a prescription drug benefit only for people on Medicare. And then Barack Obama did what Franklin Roosevelt, Harry Truman, Richard Nixon could not do. He passed and signed into law the Affordable Care Act, extending health care coverage to millions of people who couldn't afford it through an expansion of Medicaid and subsidies for private health insurance. And yesterday, Joe Biden signed into law legislation that will strengthen Medicare and reduce health care costs through Medicare and the Affordable Care Act, provoking Barack Obama to say on Twitter, "This is a BFD."
We're giving Medicare the power to negotiate those prices now on some drugs. This means seniors are going to pay less for the prescription drugs. That means if you're on Medicare, you'll never have to pay more than $2,000 a year, no matter how many prescriptions you have, whether it's for cancer or any other disease. No more than $2,000 a year. The Inflation Reduction Act locks in place lower health care premiums for millions of families who get their coverage under the Affordable Care Act.
Joining us now is Democratic Congresswoman Lauren Underwood of Illinois. She's a registered nurse who served as senior advisor at the U.S. Department of Health and Human Services. Thank you very much for joining us tonight. I know how important this is to you, especially because your legislation was pulled into this bill. You were advocating the affordability, the Healthcare Affordability Act, as you called it. What does that do, and how does it work in this legislation?
So since I joined the Congress, I have been hearing from so many constituents about the high cost of healthcare. My Healthcare Affordability Act says that no American would pay more than 8.5% of their income for silver level marketplace plans. This is for people that purchase their own healthcare coverage, and it extends the popular tax credits, which makes their premium prices more affordable. This was first signed into law as part of the American Rescue Plan in the spring of 2021. And then we saw 14.5 million Americans enroll in coverage. That American Rescue Plan provision was set to expire at the end of this calendar year. So what we have in the Inflation Reduction Act is a 3-year extension of these incredibly powerful, popular tax credits that allow people to find coverage, oftentimes for less than $10 a month.
So I'm imagining your days as a nurse and encountering people who have affordability struggles with the healthcare services that you're part of providing for them. And I assume in those days you were thinking occasionally, as everyone does, gee, if I was in Congress, I would do. Is this anything like what you imagined it to be, trying to legislate healthcare improvements back when you were working as a nurse?
Well, I didn't anticipate, the twists and turns of the legislative process, but I think it's pretty impressive in one term in Congress to be able to extend tax credits for 5 years and thereby reducing the uninsured rate in the United States to the lowest levels in U.S. history. That's what we have done in the last 2 years. And so, I didn't know that it would take the form of these kinds of tax credits, but I think the impact is something that every nurse in this country can be proud of.